You know, at St. Francis and St. Gertrude's, we're really looking at taking care of people's minds, their bodies, and their spirits. I see patients every day who have life-changing events that they have no control over. This can start a downward spiral. We can say, well, you have to go to the emergency room and admit yourself as a patient. But if we have the opportunity for social work to get involved, we can say, there happens to be a social worker. She's housed in the emergency department, but she's really good at navigating some of these life crises, which allows the person to, kind of stand up tall and make that walk feeling like they've got someone who's on their side instead of just trying to hospitalize them.
A large number of people that come to the hospital for emergency services don't have emergencies. People that struggle with anxiety or depression, bipolar illness, mental health conditions. We don't have the time or the staff to care for this large group of patients, which is our primary mission, right? We're here to provide the community with this service.
These things often seem maybe small to the people living on the outside of it, but if you can't get employment or you can't get insurance, it feels devastating. So being able to help someone do those things or keep their lights on, that's huge.
We know what happens when we don't have adequate ability to care for people. We see them again. We see them for the same problem, and we see them over and over again. At St. Francis, Bethany is our social worker, and we get her involved early on in the evaluation of a number of our patients.
When somebody is going through a traumatic change, a divorce, a loss of job, a relapse and a chemical dependency issue, I can sit down and talk with them and link them up to a mental health practitioner in the community. Are you feeling stressed out because you can't get a job? Did you lose your insurance? I let them share their story with me.
She can hear from them what their concern is, and then the two of them can kind of walk down together, and it preserves that patient's dignity because now they've met a supportive person and they don't have to be in fear of what's going to happen next.
Social workers are really our best resource for knowing what's available. They know what rehabilitation facilities are available, sometimes home therapy. All those things can be arranged to try to keep people out of the hospital but keep them safe.
Patient comes in and they're looking at losing their medical assistance. They can provide me with the paperwork. We can look at it together.
As physicians, we don't have the knowledge or time to investigate or properly help them with that. Our hospital has been growing. Our emergency department volume has been increasing. Absolutely, we need more social work support at St. Francis.
It's really important, I think, when we're providing really good, high-quality care to patients that we pay attention to their mind, their body, and their spirit. That's a strength at St. Francis and St. Gertrude's.
One day you may wake up and you feel fine. You think, what are they telling me? I have MS? The next day, you're not able to get out of bed. When I was diagnosed, I was 48 years old. I had a 13-year-old son who was very active. I worked full-time as an accountant. My husband, the day I found out, I came home and he said, if you think I am going to support you when you need it, I'm not. To end up in a nursing home, when I came here, I was 60 years old. I lost the ability to walk, and now I'm getting tremors. It's a horrible disease.
Someone who's going through the changes with multiple sclerosis, they have a tremendous sense of loss of control. They can't change what's happening to them.
I was angry. And then I was here like 3.5 years, and Integrative Health became a part of it. And it just changed my life.
Barb has received quite a few integrative health therapies to help get her to a better place that she wishes to be.
If they're experiencing significant pain from a physical body standpoint and they are under stress, then they're not going to heal well. With the comfort massage, that provides for relaxation and just an overall sense of an improved well-being.
I'm glad I am here now because this is where I need to be. I wouldn't be able to turn my neck. She'd work on it. I could turn it. Now when I get a headache, I take 2 Tylenol. In the old days, I would have to take pain pills every 4 hours. Before integrative health, I just thought, there's nothing attractive about me. There's nothing nice about me. And since integrative health, I'm beautiful. I really, really am.
Being cured is not always possible. Some ailments can't be cured. When we address that whole body, mind, and spirit, healing is always possible.
For me, the mind, the body, and the spirit connection is really important. The way we treat our body, the way that we think, all of that sort of nurtures the soul and the spirit to feel like that there is hope.
Crisis can happen at any time. Having more social services in the emergency department would be incredibly valuable.
St. Francis needs the role of the social worker in the emergency department. It's critically important.
I absolutely feel like there has to be more social work available.
Mentally, I'm feeling completely different about myself, and she has taken away a lot of my pain. Life would be horrible if these resources weren't here for me. It changed my life.